Doctors wrongly assume that their patients' anger over increased premiums, copays, and deductibles is an indication that they are also unwilling to pay for cash-based services. These are two different things in your patient's mind, and this false assumption will cost you millions in your practice. You see, your patients are rightly angry about the rising cost of healthcare. When politicians talked about the Affordable Care Act, they said the average family would save $2,500 a year. Instead, patients saw their premiums skyrocket. To try to control these out-of-pocket expenses, patients signed up for plans with lower premiums but higher copays and deductibles. So patients are upset that they didn't receive the promised savings, and even more upset to find out that they've been paying their premiums for years, and when they finally have a need to come to your office and use their insurance, none of the monthly premiums that they've paid into the system seem to add up to a hill of beans, and they still owe an expensive copay and deductible. They are upset that they've been lied to, and they're pissed at a system that holds their wallet hostage. That said, when you offer a cash pay service, they see that as you trying to solve their chronic issues by offering new services. Let's face it, many of the insurance-based solutions don't work, or they don't work well, which frustrates your patients. So they are always looking for new solutions, and they are willing to pay for a cash service if they think it will resolve their chronic condition, especially when many cash-based services are actually less expensive than the insurance-based solution. Think PRP. PRP is a cash service, but it's a whole lot less expensive than surgery and without the months of healing and pain. PRP also resolves the pain better than many other insurance-based solutions, and that's why patients are willing to pay for it. So your patient's complaint about the cost of insurance has nothing to do with their willingness to pay for a cash service that resolves their chronic condition. And this assumption will cost you millions. Many cash-based services can generate $100,000 a year, and if you'll be in practice for the next 10 years, you've just lost $1 million for a bad assumption. For more than 2 decades, I've worked with hundreds of doctors and helped them generate over $25 million because they were willing to correct their assumptions and provide new patient-centered solutions for their patients. If you're looking to add new cash-based services, hit the link below and schedule a 15-minute conversation. Until we talk, here's to your continued success. Take care.